This part of the American Heart Association Heart Saver First Aid course deals with some of the most common environmental emergencies. Your quick first aid actions can speed recovery and may even prevent death.
All right, Tom, so what's in the plans today?
Okay, we're gonna lay some pipe over here to the left.
Okay.
And probably do something over here.
Over there?
By the fence there.
All right.
Oh, if we look over here, some over here.
Hey, look, Tom, there's a raccoon in this bush. Ow! Darn thing bit me. Help, man.
Hey, get away from him, Paul. Look, he may be rabid. Look, I know first aid. Let's get you to a safe area and take a look at your hand. Yeah, he really got you. So I'm gonna clean this wound, all right? Then I'm gonna rinse it with some water. And later I want you to wash it with soap and water, okay?
I can't believe you broke his skin. Look at that, man, it's bleeding.
Oh, I can stop the bleeding. Here, take this towel. Look, I don't have my gloves. I want you to apply some pressure. Okay, good.
Report all wild animal bites to the police or an animal control officer. The bite of a rabid animal is especially dangerous. You should suspect that an animal may have rabies in the following situations. If the animal's attack is not provoked, if the animal behaves in an unusual manner, for example, if a friendly dog becomes aggressive, if the animal is a wild mammal such as a skunk, raccoon, fox, or bat.
There are 4 types of venomous snakes in the United States. A venomous snake is one that injects its venom or its poison with its bite. Rattlesnakes are most commonly encountered and cause most of the bites in the U.S., and they are also responsible for the few deaths every year. The other poisonous snakes are copperheads, such as this one here, water moccasins, which we also call cottonmouths, and coral snakes. Venomous snakes don't always inject venom when they bite. About 1/4 of the snake bites in the U.S. are so-called dry bites, where no venom is injected. Sometimes you can identify a snake bite by its mark or the way it bites. If I could have a volunteer, a non-venomous snake bite leaves tooth marks in the shape of a horseshoe, much like this. The bite of a non-poisonous snake, such as this rosy boa or a corn snake, can be painful and may cause swelling and redness, but has no other harmful effects. Rattlesnakes, copperheads, and water moccasins usually leave 2 puncture wounds at the bite site that are about 1/2 inch apart. But they also may leave just 1 bite mark if they only get 1 fang into you. The coral snake tends to hang on and chew its poison into its victim rather than strike and release. Coral snakes are the most poisonous snakes in the United States, but fortunately, unless they are provoked, they rarely bite people. Snakes can bite more than once. In fact, some can strike about half the distance of their body. So you need to be careful around a wounded snake. The best thing to do is to back away and go around the snake. If by accident the snake has been killed or injured, do not handle it because a snake may bite even when it is severely injured or close to death. If it needs to be moved, a shovel is usually the best thing. If you don't need to move it, it is best to just leave it alone.
Often you will not see the snake that bit a victim. If you are giving first aid to a victim of an unknown type of snake, assume that the snake may be poisonous. Signs of a poisonous snake bite are severe burning at the bite, swelling of the bite area within 5 minutes of the bite, nausea, vomiting, sweating, and weakness.
Ow! Oh! Raphael! Help! The snake bit me!
Get back, ladies, get back. It could strike again. Dottie, stay calm. It's okay, sit still. Phone 911. Did you see what the snake looked like?
No! What if it was poisonous? What should we do?
Try not to move that leg. Can you bring me something to wash the wound? I don't know if the snake is poisonous or not. That's why we called 911.
Oh, it hurts! It hurts! Shouldn't you suck the poison out or wrap it or something?
You know, Dottie, I just took a first aid course and we don't do that. Just stay calm, Dottie, and try not to move that leg.
When giving first aid for a snake bite, you should be sure the area is safe. Get the victim and bystanders away from the snake. Phone or ask someone to phone for help. Keep the victim as still and calm as you can. Tell the victim not to move the bite area. Gently wash the bite area with soap and water. If the bite was caused by a coral snake, apply mild pressure by using several elastic bandages to wrap the bite and wrap the entire arm or leg. You should suspect a coral snake bite if the snake holds on after the bite. There are also some things that you should not do when giving first aid for snake bite. Do not apply cold or ice. Do not try to suck out or remove the poison in any way. Do not use local electric shock. Do not use homemade remedies. We have all been bitten or stung by an insect or a spider. The usual signs of an insect bite or sting are mild pain, itching, and swelling. A small number of people may have a bad allergic reaction to some bites or stings. The first aid actions for bites or stings are wash the sting or bite area with soap and water, put an ice pack wrapped in a towel or cloth over the sting or bite area, check the victim for at least 30 minutes for signs of a bad, life-threatening allergic reaction. Bees are the only insects that leave their stingers behind. If stung by a bee, you should look for the stinger and remove it.
Oh, ow. What happened?
I got stung by a bee, I think.
Scrape the stinger and venom sac away with something hard, such as a credit card, one edge of a pair of scissors, or the back or dull side of a knife. Then give first aid for the wound like any other bite or sting. Wash the sting or bite area with soap and water. Put an ice pack wrapped in a towel or cloth over the area. Check the victim for at least 30 minutes for signs of a bad allergic reaction. Some people can have a bad allergic reaction to a spider or insect bite, especially a bee sting. People who have had these bad allergic reactions usually have an epinephrine pen and know how to use it. They often wear medical identification jewelry. In the medical emergency section, you saw an example of a bad allergic reaction to a bee sting. Signs of a bad allergic reaction are swelling of the tongue and face, breathing problems. The first aid actions for a bad allergic reaction to an insect bite or sting are the same as for any bad allergic reaction. Phone for help. Ask if the victim has an epinephrine injector. If so, get the injector and help the victim use it if you are allowed and trained to do so. Now you can remove the bee stinger. Stay with the victim until the victim feels better or help arrives. The bite of most spiders is so mild that the victim may not even know that he or she has been bitten. There may be some discomfort, redness, swelling, or pain at the bite area. The first aid actions for most spider bites are wash the bite with soap and water, put an ice bag over a towel on the bite, stay with the victim for about 30 minutes, and watch for any of the general signs that we will discuss.
In the United States, only 2 spiders can cause serious illness or even death. They're the black widow spider and the brown recluse. The black widow is shiny black with a red hourglass shape on its underside. The brown recluse, like this one, is found mainly in the southern and midwestern states. It's a light brown with a darker brown fiddle shape on its back. The bark scorpion is found mainly in the southwestern United States. It's the only North American scorpion with a sting that can cause death.
The bite of non-poisonous insects causes mild signs of redness and itching at the bite area. The bite of a poisonous spider or scorpion, on the other hand, causes general illness. Some examples of general signs caused by a poisonous insect bite are muscle cramps, headache, vomiting, breathing problems, unresponsiveness. If you know that a victim has been bitten by a poisonous spider or scorpion, or a victim has any signs of general illness after such a bite, phone for help right away. Stay with the victim and watch for unresponsiveness and start the steps of CPR if needed. Ticks are found in wooded areas. They attach themselves to exposed parts of the body. Many ticks are harmless. Some carry serious diseases like Lyme disease. This map shows the places in the United States where Lyme disease occurs. Note if you are in an area where Lyme disease is common. The longer a disease-carrying tick stays attached to a victim, the greater the chance that the victim will become infected. Remove an attached tick as soon as possible. Here's how to remove a tick. Hold the tick with your fingers or a special tick-removing tool. You may use tweezers, but try to avoid pinching the tick. Hold the tool as close to the victim's skin as possible. Lift the tick straight out of the skin without twisting or squeezing it. If you lift the tick until the skin tense and wait for several seconds, the tick may let go. Save the tick in a plastic bag and give it to the victim. Wash the bite area with soap and water. Put an ice pack wrapped in a cloth or towel on the bite. If you are in an area where Lyme disease exists, suggest that the victim get medical attention. Your instructor will now present case examples so you can talk about what you have learned.